Good morning, everyone. Thank you for joining PHCA for today's webinar, The Adequacy of Your Advocacy, How to Make Your Case to Legislators. I'm Wendy Johnson with the Pennsylvania Healthcare Association. PHCA offers monthly webinars to members to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and to gain a better understanding of practical application tools to equip you so that you can continue to provide the highest level of quality care possible. Before we begin, I have a few housekeeping items to cover. This webinar is being recorded and will be made available on the PHCA website by the end of the day. The webinar has been approved for one continuing education credit for nursing home, assisted living, and personal care home administrators. Certificates will be emailed later today along with a link to a survey. Please complete this survey, and if you are participating in a group setting, have each participant also complete the survey. All attendees will be in listen-only mode. However, throughout the presentation, please feel free to submit questions using your question pane on the right hand of your screen, and our presenter will address them at the end of the presentation. Now for today's webinar. This webinar is being presented by Zach Shamberg, our very own Director of Advocacy and Legislative Affairs here at PHCA, and LaShuan Bethea, Vice President, Legislative Affairs with Genesis Healthcare. Flat funding for the last 4 years. An out-of-control legal system swimming with predatory out-of-state lawyers. Regulations and government rules that become more burdensome by the day. There's no shortage of issues PHCA will be advocating for or against in 2018, as we're stationed in Harrisburg to support you, staff, and your residents. But we can't do it alone. One of the most important aspects of our advocacy will be you and your staff and your ability to invite a legislator to your facility and show him or her why our issues matter. We hold an annual rally day in Harrisburg to speak to state representatives and senators at the Capitol. But that's just one piece of the advocacy puzzle. The real grassroots work must be done at your nursing home, personal care home, or assisted living residence. This webinar will walk you through step by step the advocacy process and how to best share your message with local legislators. You'll also learn about the long-term care issues that we will surely be discussing here in Harrisburg in 2018. Whether we're asking legislators for increased funding, tort reform, or decreased regulation, we need you to convey the message. At the conclusion of this webinar, participants will be able to deliver talking points to legislators regarding key legislative bills involving topics such as budget funding, tort reform, and quality care, discuss relevant legislation and the potential impact such legislation may have on the long-term care industry, review legislative priorities for committees and legislative caucuses, develop relationship-building strategies with local legislators, and lastly, build advocacy plans and events with colleagues and other staff. I'll now turn the webinar over to Zach and LaShuan.
Thanks, Wendy, and good morning, everybody. Thank you for joining the webinar. I'm Zach Shamberg. I'm the Director of Advocacy and Legislative Affairs for PHCA. I do have LaShuan Bethea with me from Genesis Healthcare, and she's going to join us a little bit later in the presentation. I want to echo a couple things that Wendy said. There are a lot of big issues right now facing our sector, and whether you're working in a nursing home or a personal care home or an assisted living residence, there are things in the state capitol and going on all around Pennsylvania that have deeply affected the way you do business on a daily basis. The lack of funding from state government, the out-of-control legal system, the out-of-control regulatory system, all of these factors have built up over time and have worsened over time to make it so that some of our members have come to me and asked, does government want me out of business? Do they want me to stop operations? And I don't know how to answer that question, because on a daily basis, if I'm in the Capitol or if I'm sitting with a legislator or somebody in the governor's administration, I'm not really sure if people think long-term care, nursing homes, personal care, or assisted living are a viable option anymore. I'm going to talk a little bit about the governor and his administration's push for home and community-based services a little later in the presentation. But one of the things that I want to get across to everybody today is that we have a real chance and a real opportunity to make a difference, to advocate our position this year, and to show why we are very necessary in Pennsylvania and all around the country. Now, we were supposed to start off this morning with State Representative Warren Kampf. And Warren Kampf, for those of you who may know, is a real champion for this sector. He has sponsored a tort reform bill for us that we'll talk about a little bit later. He's on the House Appropriations Committee, which controls the funding in the House of Representatives, and he has made it his mission to ensure nursing homes receive more Medicaid funding. And he's been with us on other smaller pieces of legislation that have come through his chamber. Again, Warren was supposed to be with us, but due to some unforeseen circumstances, he is not able to join us. And rather than remove this slide, I do want to share with you some of the things that he shared with me to relay to everyone on this webinar. And the question is, for a state representative, why is advocacy so important? And what Warren shared with me, and what he shared with many of our members, is that Harrisburg, and specifically the state capitol, is crawling with lobbyists. I'm technically a lobbyist. Russ McDade, our CEO, is technically a lobbyist. And though we only have one issue to talk about, long-term care, we're still seen as the guys who come up and advocate on behalf of a sector or an industry, and then we leave and we go home and the problems stop there for us. That's all we need to do. What Warren said to me is that what becomes really powerful is hearing directly from those that these issues affect. There's no better way to do that than to bring him or any state legislator into one of your buildings. And we're going to talk about that later. But what Warren told me was that being on the front lines, seeing the challenges that you face every single day, seeing how inadequate funding affects you and prevents you from doing the things you want to do, seeing how an ad in a newspaper against your facility makes your residents and your staff feel, seeing how out of control fines, for instance, or state CMPs, civil monetary penalties, would affect the way you do business. That's what is really going to convince someone to vote yes on our bill or to vote no on another piece of legislation. There is no better way in Warren's mind, and we heard this last year from State Senator Cameron Bartolotta, there's no better way to understand these issues than to see them firsthand in a building. So I did want to share that with everybody. Now, I do want to go to my background real quick, and you may be saying, who is Zach to talk about some of these issues, and where did he pick some of this stuff up? Just to give you a quick overview, and that was the best picture I could find, I'm sorry. I was a campaign intern for U.S. Senator Pat Toomey during college. After college, I went to manage a campaign for State Representative Todd Stevens, who represents a part of Montgomery County down in Southeast PA. I was also his chief of staff. And since 2014, I've been the director of advocacy and legislative affairs for the Pennsylvania Healthcare Association. And Wendy must have added that male model at the bottom. I'm not sure how that got on there. So let's step back. What does it mean to be a grassroots advocate? As I said before, you're on the front lines. You are the boots on the ground. You're living this life in a nursing home, personal care, assisted living every single day. So it's on you as a grassroots advocate to raise awareness, because you are going to be able to influence the public perception, the policy, and the regulations. So as we look at advocacy, there are four, in my mind, key components of successful advocacy. One is communication, two is imminence of action, three is method of action, and four, and I think the most important step, is follow-up. So I love this saying, every avalanche starts with one snowflake. If that means that you send one email to your state rep, or you make one call, or you go visit him or her in their office, it doesn't matter, even if it's only just one. I mean, we every year ask for your staff to send emails and write letters. And if you can't get 10 or you can't get 20, one or two could suffice. And that's going to build. And then that's going to convince legislators, hopefully, to take action. And when we make our ask, here at PHCA, we're always going to give you the simplest way to make your ask, because again, the simpler the better. And I'm going to go through a couple issues later where we're going to get down into the nitty-gritty details, and you're probably going to maybe doze off or lose focus or concentration, and that's exactly what a state legislator would do. So we're going to need to make any ask that we make as simple as possible and as easy to understand as possible, because I can tell you there are 203 state reps in Harrisburg. Probably 4 of them understand healthcare and long-term care. And in the state Senate, there's 50 senators. I think 2 would understand exactly what we're talking about. And then follow-up is the fourth component of that. This is crucial to any grassroots effort. It's not good enough to just reach out to your legislator. We need to be constantly checking in with them so that we're maintaining and building a relationship, not just when we need something, but year-round. And we're going to talk a little bit about that later as well, but inviting legislators to events year-round, checking in with them year-round. And you'll see why that makes such a difference. So there are a lot of protests, a lot of gatherings, a lot of advocacy efforts going on right now. And you can see the bottom, that's the Harrisburg State Capitol. In Congress especially, we've had town halls where people are, holding disagree signs, and you have a lot of different advocacy efforts going on. I mean, we saw the Parkland shooting recently and what's been going on with that. We had school walkouts yesterday, and that's all well and good. But here's the problem, and we see this a lot, especially when people are interviewed on television about what they're advocating for. You ask 10 different people what the cause is, and you're going to hear 10 different answers. And the message is mixed, or the message is muddled. So for us, and to be successful, we've got to be organized. We've got to have consistent messaging, and we need to make sure that everybody's on the same page. So when all that comes together, what exactly does that look like? Well, this is last year's PHCA Rally Day. And we do a Rally Day every year at the state capitol. Usually it's in May or June. This year it's in mid-June. You can see everybody here, and there's Russ McDade front and center, our CEO. You can see everybody here holding newspaper ads that we've put into local papers. And we're talking about budget funding, and we're talking about the need for tort reform. This is a classic example of everybody being unified, everybody having a consistent message. And, we send everybody around to meet their hometown legislators and to communicate with them. And I can't tell you how meaningful that is for them to hear from you. So let's talk about Pennsylvania politics. Before we get into our issues, one of the things I like to do is tell you about some of the larger storylines playing out in Harrisburg right now, because sometimes when I turn on the news or I turn on PCN, I feel like I'm watching a soap opera and not so much, the legislative action of the day. So first, the politics of PA. everybody on this call has state and federal legislators who represent your facilities. You've got a member of the state House, a member of the state Senate, a member of Congress. You've got 2 U.S. senators, Pat Toomey and Bob Casey. And again, there's 203 state reps and 50 state senators. Now, right now, Republicans versus Democrats in Pennsylvania, Republicans hold majorities and strong majorities in the state House and Senate, though that's probably going to change later this year. Right now, there are 120 Republicans and 81 Democrats in the House. We're missing 2 folks who just gave up their seats to take other jobs. There are 34 Republicans and 16 Democrats in the state Senate. That is what we call a veto-proof majority, meaning that if the state Senate sent a bill to the governor and he vetoed it, the Republicans have enough people or enough Republican members in the state Senate to override his veto and make that bill become law. So that's what any majority party wants to get to, a veto-proof majority, and the state Senate has it. But we do have one Democratic governor, Tom Wolf. And, the question we always ask ourselves is, how do we balance our advocacy between Republicans and Democrats? In the old days, I would tell you that, whoever was the majority party, that's who you'd want to focus on, and you'd want to see their members, and you wouldn't really worry about what's going on with the minority party as the majority's the party in power. Those days are over. Because we have a Democratic governor, because this November, for all intents and purposes, the Democrats are going to pick up probably anywhere from 10 to 20 seats in the House, maybe 2 or 3 in the Senate, and in Congress, it could be as many as 7. We need to focus on everybody. And more importantly, as we get to the election and as we get past the primary election, which is May 15th, we need to start identifying champions who are going to be voices for our sector and support our issues wherever they go, whether that's Washington, D.C. or Harrisburg. And I'm going to need your help in doing that, in identifying those people. I can tell you that last week I spoke to a Democrat running down in the southeast in Montgomery County for a state Senate seat. And before I could really get into any issues, she mentioned, I used to work for Genesis Healthcare at their Crestview building. So that's a perfect example of finding somebody who will not only understand our issues, but likely will advocate for us in the state Senate. And I wouldn't want to discount anybody this year who's running, because there's a lot of opportunity there. So real quickly, I just want to go over some of the names you should probably know in terms of leadership in the State House and Senate. So at the top, you have Mike Turzai, who's the Speaker of the House. He's from out in Pittsburgh. Dave Reed is the House Majority Leader. He is from Indiana County. He is not running again for his House seat. So that position is going to turn over, and we're going to have a new House Majority Leader. Frank Dermody on the top right is the House Minority Leader. He's also out in Pittsburgh. Joe Scarnati is the Senate President, a good friend of PHCA. He's up in Brockway, north of Harrisburg. Jake Corman, the Senate Majority Leader, Republican from Penn State. And Jay Costa, the Senate Minority Leader. He is a Democrat from out in Pittsburgh. And yeah, you heard Pittsburgh a lot. And the leadership definitely for the last couple of years has tended to lean to Western PA. I'm hearing that more and more there is a strong call for more Southeast folks to be in leadership. So we'll see how that works out. Now, here's your Democratic governor, Tom Wolf. Tom Wolf ran against Tom Corbett in 2014, Governor Tom Corbett in 2014. For the first time in Pennsylvania's history, a one-term governor was beaten. Tom Wolf beat him. For the last 4 years, Wolf has built up his campaign war chest. He is running this year for reelection. And, there are a lot of priorities I could give you with the governor. I mean, the two that jump out right away, and you've probably heard them, he has always advocated for a severance tax on natural gas. That has still not gone through. and he was a big proponent of medical marijuana, which did pass the state house, and we've been very involved with. But those are the two real big things that he consistently comes out with. Now, in terms of our issues, and I want to make this very clear, this administration has put an emphasis, a strong emphasis, on home and community-based services. So what have they done? They've implemented managed care, and you've probably heard the term community health choices. Well, phase one of community health choices began in Southwest Pennsylvania earlier this year, January. Phase two, which will affect everybody in the Southeast, the Philadelphia and surrounding counties, that's going to happen January 1st, 2019. And the rest of the state, it will take over in January 2020. Managed care is a big deal. Managed care is a big issue, especially for folks in the Southwest, and it's going to be a big issue for folks in the Southeast in the next few months. And in terms of increases and budget increases, the governor is 4 for 4 on no increases, or if you're a baseball fan, he's batting 0 for 4 right now. The governor has yet to propose an increase for nursing homes in the state budget. Every year in February, the governor gets to give his budget proposal. And again, we'll talk about this later, the governor has yet to make funding for nursing homes and long-term care a priority. Now, what makes all this interesting, again, is that Governor Tom Wolf is running for reelection, and he's got 3 opponents right now on the Republican side. At the top, you have State Senator Scott Wagner, who's from York. In the middle, you have Paul Mango. He's a former McKinsey and Associate Partner from Pittsburgh. And then at the bottom, you have attorney Laura Ellsworth. She's also from Pittsburgh. We brought Paul Mango last week to Genesis Chapel Manor down in the Southeast, and it was a fantastic visit. We're going to be doing more visits for the Republican candidates as well as the governor. And if you or anybody in your company would be interested in doing something like this, please let me know, because what we're trying to do is really make long-term care, funding, tort reform, regulatory reform an issue in this gubernatorial election. Now, I also want to bring this up, and I think it's a really important point, and I made it earlier. This is just a brief list, believe it or not, of those folks in the State House or Senate not running for re-election in 2018. There are a ton of retirements that are going to happen in 2018. Some people say that, folks go down to Florida to retire and go to a retirement home. The real retirement home right now is the state capitol in Pennsylvania, because it seems like every day somebody new is saying, I'm not going to run again. And if you look at this list, there are a lot of names here, but I can pick out a couple. So at the top, Representative Mike Hanna. He's the House Minority Whip. He's the third in line in leadership. He's retiring. Joe Markozik. He's a Democrat, and he's the House Appropriations Minority Chair from Pittsburgh. He's retiring. Matt Baker, House Health Committee Chairman. He's retiring. Stuart Greenleaf is a senator from Montgomery County. He's the chair of the House Judiciary or Senate Judiciary Committee. He's retiring. Ron Marsico is the chair of the House Judiciary Committee. He's retiring. So not only do you have a lot of retirements, but you have a lot of folks in leadership or who run committees who are leaving, which means next year we are going to get an entirely new leadership team. And that's pretty exciting, because a lot of the things that we want to do and a lot of our legislative priorities sometimes get hung up. And unfortunately, when they do, a lot of the time it's a product of, well, that committee chair doesn't want to run that bill, or that person in leadership doesn't think it's a priority issue. Well, those days are going to be over in 2018. So we're going to have our work cut out for us later this year to really find our champions again and to find those who are going to be able to push our issues. Another big issue I want to talk about as we look at Pennsylvania is the congressional redistricting. And I'm not sure if everybody on the call is familiar with this, but let me just give you a little bit of background. Late January, the Pennsylvania Supreme Court issued an order that struck down our state's congressional map. So here's our old congressional map. There's 18 districts here. I mean, if you look at this map, there's some pretty egregiously drawn districts. If you look at the southeast of Pennsylvania, you can see the 7th district there that a little bit goes into Lancaster, some goes into Delaware County. There are political pundits who would argue that that's the most egregiously drawn district in the entire United States. And I might agree with that. So based on this map, the Pennsylvania Supreme Court said, no, these districts are not drawn correctly. They favor Republicans, and we're going to throw them out. So that's what they did. And they set a February 15th deadline for revising that district map or for making it better. So Republican leaders in the legislature asked the U.S. Supreme Court to overturn the decision. They didn't, and the Republican leadership could not get their act together, basically, to draw new maps to submit them. So the Pennsylvania Supreme Court drew their own maps, and they released them in February. Now, the state Senate and the state House Republican leadership have filed an appeal with the U.S. Supreme Court saying the state court cannot draw these maps. It violates the U.S. Constitution, and we need the districts to go back to the way they were. That decision has not been made yet. So congressional representatives have filed petitions now. The new districts are set, and until we hear otherwise, the new map is going to stand. So again, this is the old map. So just take a look. Here's the new map. And I mean, it's hard to argue that this new map is not more compactly drawn than the old map. And, I bring this up because this is a big issue, and this has preoccupied Republican leadership in both the House and Senate with how to handle this. You have a lot of state legislators who stepped up to run for Congress because there were a lot of retirements, and now they're kind of in limbo because they may not live in their new district anymore. So you probably all heard about Pennsylvania's 18th district that went to the polls on Tuesday. That was State Representative Rick Saccone versus the Democrat Connor Lamb, and Connor Lamb won that seat. But interestingly enough, in the new maps, neither of those candidates live in the current district, if that makes any sense. So, again, this is a big issue. It's something you're probably going to hear about. And, if you come up to the state capitol with us, it's definitely something that is being talked about. And in addition to that, unfortunately, a larger issue is certainly the Me Too movement, the sexual harassment charges that have been filed. And it seems like every day somebody new is being accused. So just, in the last few weeks, we've had a state senator, Senator Dalen Leach, accused. We've had Congressman Pat Meehan, who is not running for reelection. We had State Rep Tom Caltagirone, who I believe is actually still running for reelection. And recently there have been some pretty scary charges against State Representative Nick Miccarelli, who represents Delaware County. Again, I bring this up just because it is the dark cloud that is hanging over the Harrisburg State Capitol and, frankly, D.C. as well. And it's something that, we have had to work through, and something that is certainly going to be a big issue moving forward in the November election. So those are some of the issues broadly that are just affecting the Capitol and how business is done. I want to go through some of our state issues that are affecting our sector right now. And this is just a small list. But here are some of the things we're going to talk about today. So we have our funding. There's regulation. We're all trying to promote quality care and make sure legislators understand that that's our number one job, to provide quality care to our residents. We've heard about staffing bills that are going to be introduced to raise the staffing standard. Right now it's 2.7. Some folks want to raise it to 4.1, believe it or not. There's the Older Adult Protective Services Act. There are increased fines, civil monetary penalties coming from both the state and federal governments. Community health choices and Medicaid managed care. Lawsuit abuse reform, which we'll talk about, is a big issue. And again, the governor's emphasis on home care and making sure in their mind that everybody stays at home. So first, let's talk about the state budget. And again, Governor Wolf unveiled his budget proposal in February. He, in total, proposed to increase spending by just under $1 billion for the entire state budget. You know, every year, it's kind of a prerequisite that politicians invest in education. So the governor raised it $225 million. He wanted to invest in the workforce for an additional $50 million. And the opioid crisis, which is a big issue, he wanted to put in an additional $31 million, There is a proposal, and there has been for the last few years, to increase Pennsylvania's minimum wage to $12 an hour. I don't know if we have any folks from Genesis or Manor Care on this call. I've asked those companies, for example, to estimate what a $12 an hour minimum wage increase would cost. I've heard $20 million. I've heard $40 million. And that's not including anybody who makes 12 or 13 now who would want to ask for an increase to their wage. That is a big issue, and that is something that we're very focused on. And we're going to be advocating against this year. The severance tax is still there and still included in the budget. That's projected to raise $248 million for the governor. But again, I don't think a severance tax is going to go through this year. He proposed flat funding for Medicaid, long-term care, and the MDOI, which we'll talk about, was removed from the budget. So again, the governor has made his priorities clear. 4 out of 4 years, no increased funding for nursing homes, an emphasis on home and community-based services, and no MDOI, which again we'll talk about later. So that's the state budget. Let's talk about lawsuit abuse reform. And I'm sure everybody on this call knows what I'm talking about when I say lawsuit abuse reform. And I'm sure you also have seen these symbols, Reddick Moss and Wilkes and McHugh. Wilkes and McHugh is a law firm based in Florida. Reddick Moss is a law firm based in Arkansas. They have a very simple business model. They go state to state. They look for weak tort laws or bad legal climates, and it just so happens Pennsylvania has them. So they set up satellite offices. I know Wilkes and McHugh have an office in Pittsburgh. They also have one in Philadelphia. And they start checking the Department of Health deficiency reports for nursing homes. And if they find deficiencies, they put ads in your local newspaper. And I'm sure everybody has seen these ads. These are just 2 examples. Based on these ads, your facility might get a phone call or 2 phone calls or up to 10 phone calls from Wilkes and McHugh or Reddick Moss saying that they're going to file suit. And in almost every suit, they ask for punitive damages. And we'll talk about that a little bit later. But again, I'm sure everybody has seen these ads. And there are probably some on this call who have had ads run against their building. So Pennsylvania's legal climate, arguably, if you talk to folks who work in different states, it's arguably the worst in the country. We spend more, believe it or not, than $100 million Medicaid dollars per year just on litigation costs. We're ranked 2nd in the country in total medical malpractice payouts. There is no correlation between quality care and lawsuits. We've seen some buildings who are deficiency-free, who are five-star buildings, have ads run against them. And I think most egregiously, there are some companies in our membership who are now paying more on liability defense than food for their residents. So let that sink in for a minute. They're paying more to defend these lawsuits than on food for their residents. So that's lawsuit abuse reform. Let's talk about regulation. And I said this last year in our first advocacy webinar, but I want to use it again. It has really become, unfortunately in Pennsylvania, the perfect storm of regulatory pushes against our industry. And sometimes you probably feel like George Clooney or Mark Wahlberg in this photo. The perfect storm began a few years ago when the Attorney General, Kathleen Kane, started to file suit against some nursing home companies. And based on that, we had a Department of Health nursing home task force, which was filled with academics from all over the country, come in and look at some of our practices and make recommendations based on what they thought would make nursing homes operate better and what would heighten quality care. We also had the Auditor General, Eugene DePasquale, take a look and issue a report on the Department of Health survey practices and what would ensure that the Department of Health was monitoring us correctly. Well, in the years since those different pieces have taken place, I'm sure you've all seen it. You've seen higher fines, and we'll talk about that in a minute. You've seen more complaints. The anonymous complaint system, for instance, has come back, and we're getting reports from folks in our facilities who tell us that the Department of Health is in once or twice a day based on anonymous complaints. And many of you know those anonymous complaints are coming from disgruntled or just fired employees, or they're coming from what we call frequent flyer families who call once a day, every day. But the Department of Health still needs to come in. And when they do, they may find anything wrong and cite you for a deficiency. The picture I have on the screen now, that's Russ McDade on the far left, and there's Mike Wiley. He's the chair of the American Healthcare Association board. He's also on the PHCA board. He's with Genesis Healthcare, and we asked him to testify at a public hearing a few weeks ago down in Philadelphia. That's Senator Art Haywood. He's a Democrat from Philadelphia and Montgomery County. He's also the Democratic chair of the Senate Aging Committee. And it was his idea to do a public hearing on how nursing home complaints are handled. It was that much of an issue for his constituents that he thought he needed to bring folks in. So the long-term care ombudsman was there, the Department of Health was there, and Mike Wiley was there to testify on behalf of nursing homes. I bring this up because, again, it's become so prevalent across the state that folks are calling their representatives and asking, can you tell us about how complaints are handled and what I should do? And if I want to complain, who should I go to? The more and more of the emphasis is on making sure, the departments catch us, not working with us to make things better. So take a look at this chart, and I think this is really powerful for everyone to see. So the Department of Health civil monetary penalties per year in dollars. Now look at these amounts. In 2014, it was only $79,000. In 2017, last year, it jumped to over $2 million for a total of $2.6 million over those 4 years. The total number of civil monetary penalties individually, and I hope everybody can see this chart, went from 42 in 2015 to more than 130 last year. Now, that doesn't just happen by coincidence. There is a strong desire, there's a strong motivation from this administration to issue more CMPs. We were told a couple years ago, or the Department of Health was told, that we had the second least amount of fines issued in the entire country against nursing homes. Pennsylvania did. And rather than celebrate that fact, it was determined, well, that, hey, the Department of Health isn't doing its job well enough. They're not finding enough problems. And you have to understand that's the outlook that this administration has. So we've talked about budget funding, the lawsuit abuse reform, as well as regulatory reform. So how do we combat these challenges? You know, we hold hearings as much as we can in the Capitol. PHCA does. We present in front of the Senate and House policy committees, which issue larger directives to their chambers in terms of what they'd like to do for legislative purposes, for funding purposes. We yesterday were in front of the House Aging Committee to give an overview on long-term care. We speak in front of the House Appropriations Committee, which controls all the money. But again, the most important thing that we can do is to send you in to meet with your elected officials. And this is just one example, again, from our rally day last year. That's State Representative Doyle Heffley sitting down in the light blue tie. And I know there's some folks from Genesis Healthcare in that picture. It's meeting with your legislators directly, and it's welcoming a legislator into your building. And those are some of the things, some of the pictures of recent visits we did, especially as now we're fully into the budget process. And a budget needs to be enacted by June 30th. So we've got roughly 3 or 4 months to make a difference and to make sure that we get a funding increase. These visits are going to be more and more important. And I would urge everybody, wherever you are around the state, whether your legislator has never come into your building or they've been in 10 times, to invite them back. It's truly the most important thing that you can do to advocate for your position. So just a couple things to remember if you're going to do that. And one, which I did not write on this list, but is tell us, tell me, tell PHCA that you're going to be doing this, because we'd love to be there and we can always help you. Please use us as a resource. But things to remember as you're taking a legislator into your building. Make sure to tour them through the hallways. Highlight any practices or awards that you've gotten or innovations that you're doing that maybe a company down the street is not. Make sure to introduce your legislator to staff as well as residents. I have yet to do a visit to a nursing home with a legislator where that legislator didn't know somebody who was either a resident or a staff member. The day that you're bringing them in, ask family members of the residents to come in and visit and talk about the care that their family member is receiving. That's always been a really powerful talking point. If you're assisted living or personal care facility, because nursing homes can't really bring a lot of their residents into, maybe a common area, we find that with assisted living and personal care, doing a town hall for your residents and inviting all your residents to have kind of a speaking engagement with the legislator works really well. And if you're a nursing home, to invite some family members to a town hall, to have them come in and ask questions and hear an update, especially in an election year. This is really important because legislators are going to want to meet with and touch as many folks as they possibly can. So if we schedule a visit and we also make time for a 20-minute town hall, it will work really well and it will go very far in helping that legislator and communicating our issues. At the end of every tour, I take 10 to 15 minutes to sit with the legislator and to discuss state or local issues. This can be done in a conference room, in a lunch room, wherever you'd like, to to, after your tour, sit with them and say, what jumped out at you? And do you see why we would need more funding, or do you see why this regulation has really affected us? Make sure you take into account 10 or 15 minutes to sit with that legislator and make a formal ask. And always before they leave, invite that legislator back for another event, whether it's another visit, whether you're having a holiday party, you're having an open house, whatever it is, make sure to invite your local elected officials, because even if that legislator can't come, chances are they'll send a staff member. So here are some talking points that I want to give you, and I want to go into a little detail on. So the state budget, what are we asking for in the state budget? Again, nursing homes have been flat funded 4 of the last 4 years. So we are asking this year for a 2.6% increase in the budget. That's $44 million state dollars. Additionally, we're asking for $17 million to fund the MDOI or Medicaid Access Add-on. Keep in mind the Medicaid shortfall right now, how much you're actually getting paid versus what it costs to care for a resident on Medicaid. You're losing every day $27.25 per day of care. For a 100-bed facility where 90 of the residents are on Medicaid, that's a big, big number. And we need to make sure legislators understand that. Where did we get the 2.6% increase from? That's the skilled nursing facility market basket update that basically takes into account all the annual cost increases associated with nursing facility care. Here's an important point to make to your legislator. A 2.6% increase this year is really not an increase. It's just keeping you on track with rising costs. It's just enabling you to keep your head above water. So I said $17 million to fund the MDOI. What is the MDOI? We use that term a lot. That's the Medicaid Access Add-on Payment. This money goes directly to high Medicaid facilities. So to qualify, your building has to be greater than 65% Medicaid, and you have to be more than 85% occupied. We devised this a couple years ago because we saw the influx of Medicaid, and we wanted to make sure the higher Medicaid facilities were getting a funding pot of money sent directly to them. So this funding mechanism is not directly in the state budget. It's been put in the fiscal code or the public welfare code bills the last couple of years. These are bills that will pass alongside the state budget. We've always asked for $16 million for this. We've only ever been funded at $8 million, and I'm hopeful that that is going to change this year. So I said earlier that, we throw out a lot of big numbers, and sometimes when I do this, a legislator's eyes will glaze over because you've got to keep in mind, especially during budget season, every group that comes into a legislator's office has their hand out. Everybody is asking for more money. So here's what I would recommend you do as a frontline staffer. What would that $44 million increase mean to you and your building? Or if you get the MDOI payment and you're a high Medicaid facility, what would that $17 million mean to you? Could you invest in more staff? For instance, is turnover a problem? Are you having trouble recruiting staff? Are you having trouble retaining staff? Could you put that money towards investing in your staff? Could you invest in capital improvements? I know the average age of a nursing home right now is 35 years. Could some of that money go towards capital improvements? What about technology or innovation? Or most importantly, investing in quality care? When you're making your budget ask to a legislator, you have to ask yourself, what could you do if you were adequately funded, and how would that improve the quality of care you provide? That's what's going to make a difference for our ask. Now, for lawsuit abuse reform, I want to just go over some of these points. We're asking legislators to cap punitive damages at twice the amount of compensatory damages. In Pennsylvania, doctors have had caps on punitive damages since 2002, so almost 16 years. The predatory out-of-state law firms that I talked about earlier, Wilkes & McHugh and Reddick Moss, that go state to state, the only way to really draw them out and to send them back to Florida and Arkansas is to cap punitive damages. We've seen other states do it, and that's what really works. That's what shuts these out-of-state law firms down. But when you talk to a legislator and you start talking about capping punitive damages and you get into the minutia of this bill, sometimes that's hard to understand. So what I would say is, remember, you are the experts. So when we look at these ads, it's your job to say, what effect does this ad have on your staff or your residents or the families of your residents? If you've had a lawsuit filed against you, think about this. How much time do you spend preparing for a deposition or gathering paperwork when a lawsuit is filed? And how much time does that take away from your main goal, providing quality care? I know how hard everybody on this call works every single day, and I can't say it more directly. Wilkes & McHugh and Reddick Moss file these ads because they want to put you out of business, plain and simple. And we've seen now companies like Extendicare, who had 30 buildings in Pennsylvania, leave the state. We've seen companies like Montgomery Health leave the state. Last week, HCR Manor Care publicly noted that they would be filing for bankruptcy. It is a big product, or the struggles of some of our companies are a big product of this legal climate. And we need to get this fixed. And that is the conversation that you need to have with your legislators. The fact that you work hard and that you're working to provide quality care, and there are folks who come from other states who want to just put you out of business. And we need that to be fixed. And in terms of regulation, it's important to note to a legislator the kinds of regulation you comply with every day. Are fines and deficiencies a problem for you? Are you finding that you're spending more time on paperwork than actually spending time with your residents or providing that quality care? And talk to them about the perfect storm. Talk to them about the outside forces in the governor's administration that have kind of descended on this sector to make business difficult for you every single day. It's a big piece. There's no official ask right now to the legislature, but it's something that they certainly need to know. Now, I want to bring in LaShuan Bethea. She's the Vice President of Legislative Affairs for Genesis Healthcare. And I want to ask LaShuan two things, because she's our expert down in D.C. And in the federal capital. LaShuan, can you give us a national perspective on some of the issues that everybody on this call should be aware of in D.C. and at the congressional level? And can you just add to anything that I've said, from your standpoint, what really works in terms of advocacy and communicating with a legislator?
Absolutely. Thank you so much, Zach, for having me on the call. I think I'll start by piggybacking on what you said in terms of what really works when you're talking to members of Congress. And the recipe is really the same in terms of what you're doing at the federal level and what you're doing at the state level. However, the biggest caveat to remember is that you have far more members at the state level than you have at the federal level. And so what does that mean? That means you have a lot more competing interest for that member's time and attention. So as Zach stated earlier, you know, we represent one industry. And so for every one of us that makes a visit to a federal senator or a member of the House of Representatives, there are probably 100 more advocating for their specific interest. And so as a result of that, what I've found is that what is most effective is giving them real life examples. It is one thing for me to go into a member's office and say that there is a staffing shortage of nurses and nursing assistants across the country. It is another thing for me to say to them a specific example. I went into a facility last week. I talked with the nurses and they are telling me that they're spending so much time doing paperwork that it is more difficult for them to see their patients. Or I went into a facility last week and I talked to one of the residents there, and they're saying that their nurses are documenting all the time. They're on the computer all the time. I have to wait for them a little bit longer. So giving them an actual example of something that a resident said to you or that a nurse said to you, or your experience in comparing 10 years ago and what it was like to practice as a nurse or to see the nurses in your facility or nursing assistants compared to what it is today. And if you are going to be participating in Advocacy Day and you're not the actual individual that has the experience, go and talk to the nurses, the nursing assistants, the residents, and write down what they say. It is nothing more powerful than to sit down with a member of Congress at the state level or even at the federal level and pull out a piece of paper and say, Miss Jones, we couldn't afford for our nursing assistant, Miss Jones, to come and see you today because she needed to be there to take care of the residents. But let me tell you what she wanted me to say to you, and read those words, what she said when this piece of legislation passed or when we're not able to get funding to hire more nurses. Give them their exact words and leave that note with that member of Congress. There is nothing more powerful than giving them an actual example or an actual message. And I think the one thing that is probably, the only thing that's probably more powerful than that is what Zach said, is an invitation in the center so that they can see for themselves the impact of a law, the impact of not having adequate funding, the impact of a piece of regulation and how it's impacting the center. Again, it's one thing to say we have a staffing shortage. It's one thing to say we're not getting adequate funding. It's another thing for them to actually come into the building and see and talk with staff and see firsthand what the impact of not having adequate funding, not having staffing, the impact of talking to a facility that has actually had tort reform or lack of tort reform be an impact on their building. Again, they really need to see it firsthand because they have a lot of competing interests. And what is going to impact them the most is being able to remember the story, remember the conversation, remember what they visually experienced when they walked into the center. So again, real life examples is going to be probably the biggest impact. And I think one of the other things that I would like to add before I get into quickly what are some of the bigger issues at the federal level is that when you go in to meet with a member, you want to be concise in your messaging. So again, you want to be powerful. You want to give them a real life example. And I think Zach said this earlier, you want to have basically a strategy for how you're going to communicate with them. So number one, you're going to give that example, real life, if possible, actual words from residents or staff members. And if you can spare the staff member, then having the actual staff member there to talk about their experience. Number two, invite them into your building. You want to show them exactly what the impact is. And then number three, tell them what it means for them to support your cause. Tell them exactly, this is what is going to happen if you support adequate funding for our building, or if you are supportive of giving us resources to be able to hire more people, or whatever that specific issue that you're telling. Tell them what is the impact of them supporting, and then also what is the impact of them not supporting the cause, because they need to be able to connect the dots. Don't assume that they are familiar with our industry and they will know, well, if I don't support this, nothing will happen. Tell them what the outcome of failure to support, and as well as supporting a particular cause would be. So those are the biggest, I would say the biggest takeaways in terms of meeting with someone at the state level as well as at the federal level. Again, at the federal level, the biggest picture is that you have they represent far more people. From a senator's perspective, there's only 2 senators that represent each state, including Pennsylvania. And then at the in the House of Representatives, there's 435 total that represent the country, but only 17 for the entire state of Pennsylvania. So again, 17 people represent all of the people and industries of Pennsylvania. So they're being stretched in a lot of different directions. As far as big issues that are impacting, there's a lot of things going on, as you all can imagine. I try to think of what are the things that are most important to the folks on the phone. What would you all want to hear about? And so I think the 2 big things that I'll talk about is related to, one, what is going on as far as CMS. So CMS is a federal agency which uses state surveyors to kind of enforce the regulations that are put in place. And as you all know, CMS did roll out a new survey process in November of last year. And at the Quality Summit yesterday, we actually had some representatives from CMS come and speak with us in terms of how that survey process is going. And they did note, they said there've been a couple hundred surveys that have taken place. And some of the feedback from those surveys is that the surveys are taking longer. They are requiring more individuals in the building in order to be able to complete those surveys, because again, there is a learning curve for the surveyors as well. They also have noted that some of the high level or some of the frequent tags that they have noted have been related to infection control, dietary and sanitary issues, as well as accident and supervision. They're still in the process of drilling down as to what the specific issues are related to infection control, dietary and sanitary issues, as well as accident and supervision. But I bring that to your attention to let you know that because it's a more computerized system and they in real time can track those trends, they are obviously making surveyors aware that, hey, these are issues that we're identifying across the country. So you all want to make sure that, hey, let's make sure we have our infection control tight, our dietary and sanitary issues tight, as well as that we're taking care of issues related to accident and supervision. The other thing that they did make aware, or that we're aware of, just based on feedback from, our state associations, as well as the centers across the country that have been surveyed under the new process, is that there are some inconsistencies in terms of the way that surveyors are interpreting some of the regulations, specifically around bed rails and the discharge notice requirements. And CMS is very interested, and they indicated yesterday when Karen Tritz actually spoke, she indicated that she was very interested in hearing feedback from us related to some of the inconsistencies in interpretation that we have identified. They want to make every attempt to clarify and rectify those things so that there can be consistency across the board in terms of interpreting those regulations. The other thing that I'll just piggyback on in terms of not really a trend, because it's something that's been going on, but the management of CMPs. Last year, CMS also released a CMP analytic tool. And the goal of that tool was to create some consistency in terms of how CMPs are used as a remedy in our buildings. We know that there was a lot of inconsistency in terms of use of a per day CMP, which results in a huge increase in financial remedy for a building, versus a per instance CMP, which is basically you get one amount no matter how many days that deficient practice was in place. And so CMS put some guidelines in place to help surveyors more fairly determine which remedy is more appropriate per instance versus per day. And since that, while I think we've seen a slight improvement since that analytic tool has been in place, we have seen that there are some misappropriately applied CMPs where they're using per day when in fact they should be using per instance CMPs, and it's resulted in some increased CMPs for buildings. Or we've also seen that there's been incidents where they initially awarded a per instance CMP, and then sometimes weeks or even months after the survey is closed, they've revised that to a per day. And both of those would be inappropriate. And so CMS is also interested in hearing that information as well. So if you're finding that some of those things are going on in your building, definitely reach out to your overall operators or the Pennsylvania Healthcare Association, because they can get that information to ACA or to myself, and we are more than happy to make sure that we, again, summarize that information, but make it clear to CMS that these trends continue to go on in our building. The other thing that Karen Tritz spoke about yesterday is the inappropriate stacking of CMPs. And I know that that is something that has happened in Pennsylvania as well. And one of the things that she emphasized is that each CMP should be able to stand on its own, or each time that we're tying a regulation and awarding a CMP, it needs to be able to stand independently. And there should not be this one occurrence and multiple tags for that single occurrence that hang on one particular incident. In other words, the ability to be able to stack multiple CMPs on top of each other. And so that is also something that she is aware that is occurring, and they're interested in examples so that they can attempt to rectify that. The other thing I'll just speak about briefly, because I know we're over our time, is opioid management. And opioids is a significant issue across the country, and states are just beginning to tackle this issue. And one of the things that I'm doing at the federal level is making sure that they do not forget about the long-term care skilled nursing facility industry in terms of our role, the role that we play in managing members of the community that are dealing with opioid issues. And I can tell you just from some preliminary work that Genesis has done, we have seen in some of our buildings where opioid-related admissions account for up to 60% of admissions, again, in some of our buildings. And this is not just an urban issue. It is also an issue that we see happening in the rural community. Recently, Senators Wyden and Hatch sent a letter out seeking feedback from the provider community, not just long-term care, but providers as a whole, asking what can they do to help us to be able to address that the opioid issue in our community. And Genesis definitely, I collected feedback from some of our members that are helping to manage this in our buildings, and we did submit a response. Our goal is hopefully to make sure that long-term care is a part of the conversation in terms of opioid, because we know that we're playing a significant role in managing this population, as well as making sure that there is any funding that they are providing for management of this population, that we get included in that funding. The other thing from a regulatory perspective is that these patients don't necessarily fit into the box that our typical long-term care regulations are set to govern. And so we want to also make CMS aware that our quality measures are sometimes impacted by, pain and other issues that are prevalent within this population. And we want to make sure that our centers for managing these are not negatively, impacted for managing this population, that they are aware of the impact as well. I will leave it at that, Zach, unless there is anything else that you'd like me to go into.
That was great, LaShuan. I really appreciate it. You were with us last year. You imparted a lot of great advice. I'm glad that a lot of our points overlapped in terms of, again, the most important thing you can do, whether you're advocating on federal issues or state issues, is you're the person on the front lines. You're the one who's combating these challenges every day. You're the one who should be communicating these points. So, LaShuan, thanks again. Thanks for all your work with Genesis, and we really appreciate it.
Thank you.
So real quick before we wrap up, I do want to just make a couple more points. So if you don't know who your legislator is, whether it's at the State House, State Senate, or federal level, you can go to our PHCA website. There's an advocacy tab there. Just click on locate your legislator. You type in the address of your facility, and it'll tell you exactly who represents you and how to get in touch with them. We also have a lot of one-pagers and talking points on the budget, on tort reform, anything you could want to talk about with your legislator. You can also go to the PHCA website on the advocacy tab. Just click on issue briefs, and we've got all the one-pagers there. Also, please get in touch with me directly or anybody at PHCA, and we can certainly help you. So I will leave it at that. I want to thank LaShuan for being with us again this year. And I will ask Wendy Johnson if there are any questions.
Thanks, Zach. No, not right now, but if anyone has any questions, please type them into the question pane. I'm going to throw a question out. Zach, do you want to let us know what the date is for the annual Advocacy Day?
Yeah, that's a great question, Wendy. And I was just scrolling through my phone to make sure I had the date right. It is Wednesday, June 13th this year. Wednesday, June 13th. Mark your calendar. We are going to be starting to send out information on Advocacy and Rally Day to gather folks from all of our companies, and that's nursing homes, personal care, assisted living. In the last couple years, probably 4 years ago when I started here at PHCA, we didn't have any personal care or assisted living involvement. And last year, I believe we had 4 different teams. So like 20 or 25 folks came for personal care, assisted living, and we do separate talking points and separate meetings, and it was fantastic. So again, mark your calendars, Wednesday, June 13th. We're hoping to get a big turnout. And that's a great lead-in, Wendy, to Rally Day is kind of I think of Rally Day as the cherry on top of the Advocacy Sunday, so to speak. But the real important part of that is from now until Rally Day, going to meet with your legislator, getting your talking points through, so that Rally Day is not the first time you're reaching them. It's a follow-up and saying, okay, so where are we on the things I've asked for the last couple months? Thanks, Wendy.
Great. Not seeing any questions, but know that in the email that I will send to all of you at the later today, I'll have Zach and LaShuan's contact information. So if you do have any questions, you can reach out to them directly. They'll be happy to get back to you with any of your questions, and we'll be happy to answer those for you. So thank you to Zach and LaShuan for the information today. Gives us a lot to think about. And again, don't forget that we're going to be having the survey emailed to you. So please take some time to complete it, and we'll give you the rest of your day back. Thanks for logging on today and hanging in there. We went a little bit over, so we appreciate your patience. And again, thanks for logging in and listening to the webinar today.
Thanks, everybody.